everyone, welcome to the show. I'm Dr. Nicole, and on today's episode, we're talking about what can be a tricky topic of co-parenting, especially when you have a child who may have a neurodevelopmental or behavioral or mental health type of challenge. You know, co-parenting in a situation of separation or divorce can be tough for a lot of reasons. And many of you have written in over the past year or two with just, everything from general to real specific questions that come up about this. And so I know that it's an issue that a lot of you are dealing with. There are ways to approach this that allow for better communication, emotional wellness, and just healthier relationships for not only the adults involved, but for the kids involved as well. So to help us explore this topic, I've invited Dr. Jenna Flowers on the show today. Let me tell you a bit about her. She's a psychologist and family therapist with a private practice in Newport Beach and is the clinical director of Mainspring Family Wellness, offering counseling services and parenting classes. She offers an online course for co-parenting called coparentwell.com. She's written a book called The Conscious Parent's Guide to Co-Parenting and is a court-appointed co-parenting therapist in Orange County. Dr. Flowers is also the co-host of Mainspring Family Wellness podcast, discussing all things parenting and family wellness. She herself is a co-parent to 3 children, ages 20, 13, 10, and a bonus mom to a 15-year-old son. So she's got the personal as well as the professional experience. Jenna, welcome to the show. It's so great to have you here.
Oh, thanks so much, Nicole. It's such a pleasure.
Like I said, this is a big topic for a lot of people, right? I'm not sure exactly what the formal divorce statistics are at this point, but I know that solidly it's something that probably about 50% or even more of the families listening are dealing with.
Yeah,
so I'm excited to get into this because so many people have questions around this, but I want to sort of frame this by having you share your story, because I know that part of your journey with this professionally has been your own experience around what has happened for you personally. So I'd love to have you just share a bit of your journey of how you came to be doing the work that you're doing.
Oh, thank you. Yeah. So 5 years ago, I ended up in a divorce myself, and I had 3 kids at the time. I had a high schooler, and then I think 5-year-old, and then also an 8-year-old.
Wow.
So it was a lot of transition. And the one thing that my ex-husband and I could really align in, though, was that we still really wanted to see our children know that they were loved by us, that they were so important to us, and we really wanted the very best for them. We didn't want anything to fall through the cracks for them. And so I'm so thankful that we could really unite as parents on that front, and that our kids always knew that we were still both in it and very much involved in their lives. And so we have continued with our co-parenting coming from that lens. And when I wrote the book, Conscious Parent's Guide to Co-Parenting, I actually was married at the time. And when I reflect back now, I realized I ended up putting that parenting curriculum together in that book because I'd written parenting curriculums for since 2007. And the book was written in 2015. I was actually writing my own manual for myself. And so I'm kind of living proof, and so is my ex-husband, that like it works. Like if you really put the time in and recognize like you want to have children that are securely attached in the world, and here's the steps on how to do it even after a divorce, because ruptures are going to happen.
Right.
In fact, you brought up the divorce rate. It is high, and it's even higher for family with special needs. But it's actually around 60% now. And even in my area of Orange County, California, I've heard it even like at 75%. I mean, that's crazy that it's increasing. And that's also very sad. But there is also this reality that it still happens.
Right.
And so when these ruptures happen for our children, we as parents have to make a choice of like, okay, even though this didn't work out for myself, am I going to allow it to become toxic for my children? And when we look a little deeper into the research about divorce rates, initially children who go through a divorce will have some anxiety or depression because of course they're grieving, the whole family's grieving. But children who stay in higher conflict homes for the long run have a much higher rate of depression and anxiety as a result. So if you're parents that, even though you are going through something that's very sad and it's a rupture, if you handle it really well with your kids, they'll be okay in the long run. They just really need to know that, like, my parents are okay and they're still there for me. And children really benefit from seeing a level of respect and friendliness from their parents. They still want to know that, like, are they okay? Are they, are they on good terms? Like, I've had some cases, Nicole, where parents can't even be at an open house together.
Yep.
And it's just like so sad to me that, like, you can't go to the parent teacher conference together for your child.
Yeah.
Like that this is where we're landing into more. This is a you problem versus this is, a problem for your child. And so my whole base is you create a secure connection. Both of you are very necessary to be a part of your kids' lives. And how do you go about doing that? And of course, sometimes you need some personal time to try to work through your own stuff. But if you take the time to do it, you'll get there. And that's always been my process with myself. And now I'm married. I just got married actually in the summer, and I'm learning what it's like to have a blended family. And even working with my ex-husband in that process, I'm still the primary parent for my kids. And my husband is I'm like his support for his son at 15, and he is my support. So he's not making any final decisions here because that's not his job.
Right.
And I think when you understand, like, how to organize it correctly in your home, then we're not overstepping on boundaries. And then the other co-parent also doesn't feel overstepped as well. Yeah. Everybody knows how important everyone is in this to different people in the system.
That's a great way to describe it. Really, we have this idea that, well, we divorce or we separate and then we're separate. It's like, no, if you have children, there still is a system in operation here, and you get to choose how functional or dysfunctional for that system to be. I want to touch on something that you mentioned that I think is really valuable here around the idea of, what happens to kids when parents get divorced, the grieving, the anxiety, the depression, but actually, what can happen to kids when parents stay in a really dysfunctional, contentious situation? Because I think there still is this very predominant messaging in our culture around, it doesn't matter how bad, like, you stay together for the kids because it's better for the kids. And so can we just touch on that? Because I'm sure there's people who are listening who are like, wow, this has not been good. There's been a lot of stuff, but everybody keeps telling me we should stay together. And really what you shared briefly there is that's not necessarily true, that it's better for the kids.
Yes. I mean, if you have a situation where it's a toxic, pardon me, a toxic situation where there is domestic violence, where there is chronic alcoholism or drug use, where there is abuse and violation that's occurring, I think it's really important that you get professional help and really start to work out how do you set effective boundaries. And that's not to say that you need to get divorced. It may be, though, that you do need to separate, that you need to have enough of a space and distance to both reflect on what you really want out of a relationship. Like, is this cup filling or is this cup depleting? Right. Because if your relationships are chronically cup depleting, then what's happening within your own psyche? What are you doing for your own self-care? How can you turn things around? And there is a truth too, that sometimes we do outgrow how a relationship is, how it is functioning. And if you don't have two partners that are willing to both commit to, like, this isn't functioning well for either of us, so how do we get it back on track? Sometimes we're just not aligned on that, and we do outgrow the functioning of a relationship or how it's currently functioning.
I think that's a great point. And so certainly in situations where there is clear abuse, substance use, those kinds of things. What about, though, because I see this a lot just in 25 years of working with families where there's one or more children in the family with high needs or extra challenges, it can get to the point where there's a toxicity around just both parents or one or both parents being really emotionally dysregulated, or just a lot of yelling, a lot of arguing, a lot of contentiousness. That's not good for kids either, right?
No, it's really not healthy. It's not healthy for anybody. And I think when it's gotten to that level, it's because there hasn't been enough self-care that's been laid out and properly designed in the family system,
Mhm.
where we've really given permission to everybody to like take care of yourselves.
Yeah.
And what does that look like? For someone, that might be that they go to church on a Wednesday night and they've got their women's study, or they've got a men's night where they're playing basketball with a bunch of guys, or they go on a personal retreat, or um, whatever it is for that person individually. It has to feel like it's soothing to the soul, especially when you have special needs kids,
Yes.
because
Yeah.
it is when you're a caregiver, kind of a caregiver beyond just parenting,
Mhm.
it is exhausting.
Yeah.
And so decompression points are critical. And how you both are honoring that for each other, I think is really important. The other thing too, Nicole, is that everybody has a different bandwidth.
Yes.
Some of us
Yes.
have more resilience and can take on, and some of us have just a shorter bandwidth.
Right. Right.
And it's important to have a conversation about that with our partners.
Mhm.
And if you have one partner that becomes resentful, where they're just taking on so much, which is often very common, this happens a lot. You've got one high functioning person and the other one is kind of under functioning. Some kind of conversation has to take place about this,
Mhm.
and some other solutions have to be looked at. So if that person's always the high functioner, where are their decompression points? Because they still need them,
Mhm.
right? Because if not, resentment festers and then the breakdown of a relationship
Right.
happens.
Right. And
There's always a breaking point.
that's right. There is. And sometimes when you hit that breaking point, that can be repaired over time through, couples therapy, through various kinds of things. And sometimes the decision does need to be made, or is made, that we're going to go our separate ways. And then we need to focus on, and how do we best support the kids? And this is
Yes.
that co-parenting piece. Like, it's one thing for two adults to decide, okay, we're not going to be together
Mhm.
anymore. But then what does that look like for the kids that we share together? What does that look like for how we need to communicate with one another, with how this logistically is going to set up? Like, there's a lot of decisions around that. So I'm curious to have you touch on, what are some of the common challenges that come up around co-parenting? So people are in a co-parenting situation. What do you see as some of the primary things that people struggle with or don't navigate well, or just the issues that come up there?
Well, I think communication and updating one
Yes.
another,
Yeah.
I think, is really the main one. And sometimes also kind of setting yourself up to be more important than the other parent. That can be another issue, where, parental alienation has a lot of complex layers to it.
Right.
But there are definite cases that I've seen where one parent kind of thinks they're the more important parent, and then little by little, they're saying, well, the kids decided that this, and so I'm just going to honor it. It's not my job to, enforce anything. And so then you're not co-parenting. And yet they're also benefiting from it passive aggressively, because then they feel like they have more of an alliance with their children.
Right.
And that's always, a shame, because parents need to be the ones in charge,
Yeah.
right? They need to be the authority, and they have to be able to make these decisions together. And the kids should not really be in charge of these decisions. It's a little different once our kids are older and they're teens, and there may be more critical decisions like, this is the high school guys I really do want to go to, or it's easier for me to be at this one house instead of going every a couple days because of just where my life now is at 16 or 17. That's a different conversation. But when you have littler kids that are in elementary school, it shouldn't be up to your children to make certain decisions for themselves. When it comes to living arrangements, how much time they're spending with one parent or not. And that's when people have to be adults and work together. And I think also when it comes to special needs kids, which is part of what we, I think, wanted to talk, I did want to share, like, my children actually have ADD and ADHD. So this is something I'm very well versed in. And also why I've had to maybe work more in tandem with my co-parent, more so than if I had kids that didn't have ADHD, because there are certain accommodations that I've just had to make because of the landscape of how my children are wired
Right.
and what they're needing. So it's very common that even if we do a really good job with coordinating certain things, something's going to be forgotten. Something's going to be left at somebody else's home. And then I might suggest, like, how can we better plan this for next time? But more than likely, we are probably going to have to drive back over to dad's house and pick it up, or someone's going to have to drop something off.
Right.
We have to have some flexibility with it because it's an ongoing learning about how to remember things, how to be better organized,
Right.
how to plan.
Well, and often there's more involvement that you need to have with the school and just with
Yes.
the things that your child's involved in too, and making sure that both parents are knowing what's going on with those situations and are implementing plans. Like if kids have plans in place at school or plans in place with a therapist or whatever over how things, what they're working on, that both households, both parents are involved and on the same page and promoting and working on those things in their separate environments, right?
I'll tell you, my youngest actually has, pardon me, I got COVID earlier in
Oh,
January.
no.
And I mean, even though I was vaccinated and everything,
Yep.
but I still have this
Yep.
little ongoing cough, and it just kind of comes back.
I get it.
So my youngest actually has some issues with regulation as well as ADHD.
Yeah.
And he's had occupational therapy in his background. He's had regular therapy. I've tried a lot of different, and he also does speech therapy.
Yeah.
Well, we reach certain impasses where he just gets so upset and he doesn't know how to manage his emotions. And I called my ex and I was just like, I just think he needs to go back into therapy. And my ex was like, no, I'm not saying yes to that. And I was so mad. I was like, why are you doing this? Like, he needs the help. Well, I had to just kind of put the conversation aside because I was getting upset and I didn't understand. But something else happened between our boys. And I was just like, we need to just sit down with your dad and we have to get on the same page and talk it out. And Nicole, what I took from that was when we sat down with my son, and it was just him, no other siblings in the room. And we were able to just sit and hear and listen to him. And it was a conversation about things sometimes don't feel fair. Brother is better at these things than me. I want to be this. I want to do that. And he needed both of us in the same room to just listen. Yeah. And the greatest intervention that we could give him was our ability to sit together in the room with him and then come up with solutions together and say, we're not going to go to a therapist then, because I think my ex had good insight. You're right. It's not about going to the therapist. It's about us sitting down with you and giving you some accountability to, this is what we're going to do. And then every 10 days, we're going to sit back down and check in and say, how are we doing with this? And it's made such a difference. This was the game changer that my son needed. He needed to know both of us cared and were in it with him. And a therapist couldn't do that.
Yeah. No, I love that example. And I think the challenge here, right, is that most of the time, when two adults are separating or divorcing, moving in separate directions with their lives, most of the time, it's because communication is not going well. They're not regulating their emotions and behaviors around each other, right? And so this idea that in order to really make co-parenting work and to raise the healthiest kids that we can in this co-parenting situation is going to require that the adults take responsibility for maybe improving or working on some of those things that weren't going so well in the relationship to begin with, right? And that's challenging.
For sure. But here's the great thing about it. You're no longer with that person because you romantically or, relationally didn't want to feel partnered in that way anymore. But the reality is you're still partnered as parents.
That's right.
So when you make the transition, and sometimes it's a difficult transition to initially make because everybody's grieving, everyone's tender. But you're starting to hone in on the business of parenting, the transactions of parenting, and the focus is just on the kids. One of the things that I've really noticed for my area is we have a lot of difficulty with child-centered parenting in these marriages. So many people are just so focused on their kids all the time that they're not taking care of their marriages.
Yeah.
So I will often end up seeing people that, yeah, there's nothing left between the two of them because they didn't build anything.
Mm-hmm.
They just built
Mm-hmm.
on the kids.
Right.
And so since they still have that in common, they can actually
Mhm.
function
Yeah.
and work in that.
Yeah. That's a great point. And I think sometimes too, especially when we're talking about kids with a lot of extra challenges, kids with maybe more severe disabilities, more significant behavioral issues, those kinds of things. One of the things that I've seen in my practice over the years is that when they split their parenting time, they actually become better parents because bandwidth wise, they're getting some reprieve. Suddenly, the divorce has forced them to structure their time and they get breaks, things that they weren't willing to work on when they were married of how are we going to get breaks? How are we going to divide up responsibilities so that we can both manage this better automatically happen in a separation or divorce because they're not in the same place and kids are going back and forth. And I have seen some parents grow into better versions of themselves as parents just because they're simply not around their kids 100% of the time like they were before.
Yes, I agree. And in fact, I quite a few friends, even outside of just in my private practice, that have kids with special needs and they're divorced and how they're using their time when they're not with their kids because it's so intensive when they are with their children. I mean, you're on 100% the whole time, right? Um, they're they're mountain biking, they're active, they're doing things that just feel very cup filling for them for themselves to just like replenish,
Right.
and then they can go back in. So
Yeah.
there is a bit of a tag teaming that's taking place.
Yeah. Let's get into this idea of conscious co-parenting. I think you set the stage for that really nicely when you told your story about how you and your ex have chosen to co-parent, which really is a lovely example of what conscious co-parenting is. But I'd love for you to define that. What is conscious co-parenting? We've done some previous episodes on the show around conscious parenting and things related to that. So certainly if you're listening and you missed those episodes, go check back in the episode list and maybe listen to some of those for some context too. But talk about what is conscious co-parenting, why this is so important.
Sure. So conscious co-parenting is the ability to recognize that your parent, your co-parent, is just as important as you are in your child's life. And you have to have this awareness of the roles that you both play to this little person or people, right? And so when you have that level of awareness, you have a certain respect for who that person is and what they mean to the people that you love most, which are your kids. So when I think of conscious co-parenting, I'm aware of like, this is a person that I want to be respectful of, that has his own life journey. And I want really good things for this person because I know that will only benefit the kids. And I want good things for me. And I'm really aligned with the fact that all of us have a growth path. And my pursuit is high growth and high contribution in the world. So to hold back energetically on anything that's really negative or to wish ill or anything like that, that brings me down rather than even my parent, my co-parent.
Yeah. And so it's really this idea of how can we come together and treat each other in a way that allows us to be the best example for our kids and prioritizes the healthy growth and development of our children. We're no longer committed to each other and our growth and development as a couple. That's done, right. But we're very committed to the healthy growth and development of our children. And I think something to insert here as well, some of our listeners do have one or more children with very significant levels of impairment or significant developmental disabilities where maybe, the parenting journey or the logistics and the task of parenting isn't going to be done at 18 or at 20. This is a lifelong endeavor. And it strikes me as we're talking about this, that it becomes even more necessary in those situations to approach this through the lens of conscious co-parenting, because you're going to be dealing with this for the rest of your life. And how do you want that to be for you, and for your kids? It becomes really important to think about.
Absolutely. I think having that long-term vision of like, if I just only think in the short term of like, this person has hurt me, I'm just not going to work with them. I'm going to parallel parent. I'm going to pretend they don't exist. I mean, that's your own denial.
Yeah.
So you both have to be willing to really want to work together. But I say that, and then people are still in situations where, well, they'll say like, I want a conscious co-parent, but I have an ex that is unwilling.
I was going to ask that.
Yeah. And so when that's the case, and it's common, people have this, I would still say, then still offer it. Because you never know when it might change. It could be that maybe that person just has their own inner work that they have to continue to do. But if you are doing your inner work, then you will only benefit from it. So at least you're available for it, and you keep continuing to put it out there for the sake of your kids.
I think that's such a good point, because as you were talking, I was thinking, sometimes, and I've seen that happen in the clinic too, where one parent is very committed to doing this in a more conscious, healthy way, and the other one isn't. And you can only control what you can control on your side of the equation.
Yeah. One thing I should have said earlier about some of the obstacles is when parents badmouth one another. That is another one, especially in front of your kids. Like you just don't want to use your kids as pawns, and add toxicity, or that they're aware of how you don't like their other parent. That stuff is just not helpful at all.
And those are situations, and I see that happen, unfortunately, quite often, where, if that's what's going on in your world, in your relationship, if that's how you're handling that, you really need to seek out some counseling, some psychotherapy, some intervention, and work for yourself to figure out why it is that you are doing that, why it is that you're trying to manage your own emotions and things in that way, because it is patently unfair to children. It essentially puts them back in the middle of a toxic situation that they can't get out of, because you both will be their parents forever. I mean, I think that's the key here, right? Like, regardless of what the adults in the situation decide to do about the legality or the circumstances of their relationship with one another, kids never can escape or get out of the fact that you both are their parents. Regardless of what you do with your marriage or relationship, you're always going to both be their parents. And so I think when there's that kind of dysfunctional behavior going on the part of one or both parents, that's really a call to some individual therapy, I think.
For sure.
Yeah.
For sure.
Yeah. So let's get into a little bit with the conscious co-parenting. Can you give a couple of examples of maybe strategies around that, or like a couple of, like, what does this look like in practice? How would you approach like a specific situation from a conscious parenting kind of standpoint? I mean, I'm thinking of maybe even, some of the common things that come up, like deciding on parenting time, or communication throughout the week, or making a decision for the child medically or school wise or whatever. Like, those are some of the things that come up. How does that look if we're using a conscious parenting approach? Are there certain strategies or ways that parents should approach those situations?
That's a great question. I would first start by saying, stay curious. Rather than thinking that you already know this is how it needs to be, this is the best solution. When we take that posture of staying curious and saying, well, tell me more, like why do you think the way that you do? One of the great things that I started, and what I wrote about too in my book, was actually like, I would just ask questions, rather, and not poignant questions of like accusatory, but more of like, what do you think about this? And then I would invite the opinion of my ex, rather than say, this is how it's going to be. This is where, this is what's going down. Right. If I invited the question of like, would you be interested in this for our son, for, what are your thoughts? And then we had a dialogue. And when
Mhm.
we had a shared dialogue, then it did seem that we came back to a better decision-making process.
Mhm.
So I think we kind of, because of our first age stage with our oldest, she was going into senior year. There were already a lot of questions for her with the next stage of college and what that looked like, that kind of thrust us into, okay, we're running into a new developmental stage. Like,
Ah,
we have to talk about this. Like,
yep,
college is coming up,
yep,
right?
yep.
And so that just kind of helped us get our bearings, because then when we had some other things come up for our other kids, like we've got one baseball player, so now we're talking about high schools, we're talking about,
Right.
what are we doing? And my ex and I, we talk every day, at some point, and we're friends. Like, there's a
Yeah.
friendship there now, which I really appreciate, but it's because we've stayed curious with each other
Mhm.
and really made it about the kids. So I think that's one.
Yeah.
Two, I mean, honestly, just being kind
Mhm.
and respectful. I've
Mhm.
got some cases, like I've shared, I've court appointed,
Yeah.
and I had a couple a couple weeks ago where the dad has got a terrible diagnosis for his father coming up with cancer,
Mhm.
and the mom, she cried because that was someone that was important at the time when they were married.
Right.
So
Right.
having that empathy of like, wow, I'm so sorry that
Mhm.
you're going through that. Still, maybe even asking like, how's your family doing?
Mhm.
Keeping it friendly, but
Mhm.
not necessarily always having to,
Mhm.
still like
Right.
be intrusive or anything, I think is important as well.
Right.
Um,
And I want to say something about that I
yeah,
think is important, that has come up in a lot of my discussions with parents around this, because inherently somebody will say, well, what, I don't want to be kind, like, he's not kind to me, or, whatever. It's like, I think going back to what you were saying about your own side of the equation,
mhm,
like at that point, like, it doesn't matter how your co-parent is being, you have the choice of responding with kindness and empathy,
that's right.
because that is what feels good and right to you. And
Yes.
ultimately, that's what's healthiest for you and for your kids, regardless of how the other parent is viewing it. And I think a lot of people have a hard time with that, right? There's sort of this tit for tat that, well, she's not this way, so I'm not going to be this way. And this process, it strikes me as you're talking about, is really about owning our own emotions and responses to it, and saying, wait a second, it doesn't matter. Like, if the roles reversed and my dad got a terminal illness and he didn't cry about it and he wasn't supportive about it, okay, that's him. But what feels right and good for me to do here? And that's what I'm going to lean into and do, regardless of what I think he would do.
Yeah, I often start every session when I have co-parenting sessions, because I do two individuals. I'll do an individual with each of them to just hear their story and where the
Yeah.
obstacles are.
Yeah.
But often, Nicole, where I land is, you guys are so well intentioned.
Yeah.
Like, you are such, like, you really want to be good parents. And here's what I've heard in your timeline and story about what you guys have done in the past together.
Yeah.
Because sometimes we need a reminder on, like, there were some ways that you guys really aligned and
Yeah.
you had to make tough choices and you worked it out. So since we have some of that history, let's just make some adjustments and move it into co-parenting,
Mhm.
because you're capable of it.
Yeah.
And you're both really well intentioned.
Mhm.
Sometimes we just forget that. It's like one of my favorite quotes from Brene Brown is, be generous in your assumptions
Yes.
of the other. And
Yes.
I think in co-parenting, that just goes so far.
Yeah.
So that would be one of my other things, is like, be generous in your assumption.
Mhm.
Now, I say this, and I also recognize a lot of your listeners may say, but I was married to a narcissist,
Sure.
or
Right.
I was, had a child abuse report that was unfounded. And like,
Right.
where do I go with that?
Yeah.
And those are painful things,
Mhm.
but that still comes back to you doing that your own personal work to move through that.
Mhm.
And then you do have to set appropriate boundaries.
Mhm.
And even though personally that may have affected you, if that parent still is a good parent to your child, like they still love your child, they want to be there, they want to be involved, then you have to put aside that personal stuff to then figure out how to still work with that person,
Mhm.
because there's no grounds to take that person out of your child's life,
That's right.
right? That child still very much needs a relationship with both of their parents.
Yeah. Um, as we're talking about this, I'm wondering if you have some insights or some observations around things that, particularly when we're talking about co-parenting of kids with more challenges, needs, diagnosed or undiagnosed, are there some things, some ways that you see co-parents operating, or decisions they make, maybe even about logistical things or whatever, that may be well-intentioned, but that you often see end up not working out real well for kids? Are there things that you observe or things that you can think of that you're like, yeah, I get why people maybe think X, Y, or Z, is a good way to handle it, but actually, there might be a different approach that's helpful for kids?
Can you give me an example of what you're thinking?
Like one of the things that I see come up sometimes is, even around like how they split the parenting time. Like sometimes I'll have parents who will be like, well, we just feel like it's best to do it like right down the middle. And so, he's going to take the first 3.5 days of the week, and he's going to take the second 3.5 days of the week. And that's how we're going to do it. And that type of arrangement may be a total disaster, let's say, for a kid on the autism spectrum who really struggles with transitions and maybe would do better with like a week on, week off. Like, I don't know, that's just one thing that comes to mind.
Yes. I'm so glad you brought that up. That is a great question. And that's where co-parenting therapy can be super helpful, because then hopefully you're working with a therapist that is adept at understanding developmental stages, and then also some of the particular needs that your child may have. So transitions for a child on the spectrum or a child with regulation issues is a really key issue. It's often a part of also maybe if they have ABA or if they have a certain treatment plan that you're working on how to build into getting better at transitions. So there would be some issues if you have the kind of parenting where it's like a 5-2, 2 days on, 2 days off. When they're little, that may be harder to really kind of get a rhythm on, right? Or they're missing too much time with a parent. So having some kind of conversation with a professional to help understand like what would be best suited for a custody arrangement is a really good idea. And every child is different. When you have a high schooler, 1 week on, 1 week off, maybe actually a really good idea, because there's less transition involved and they can kind of camp with one, and you can also really get a rhythm with one parent. For myself, I have a 5-2. So I have Monday, Tuesday. My ex has Wednesday, Thursday, and then we switch every other weekend. And then we have all three of the kids, because we have one at college, on the same schedule. And that works really well for us, because then we have at least 5 days of having a really nice rhythm together. And then the kids consistently know that like Monday, Tuesdays, mom, Wednesday, Thursdays with dad. Part of our co-parenting arrangement though, is that, because we don't want to leave anything to fall through the cracks. We're still helping with different pickups. We're, on our other days, because we're just outnumbered when you have more kids, right? And different functions that everyone's going to.
Yeah. And that idea of we're on the same team. And I think that flexibility is so important. Like, okay, it just makes more sense for, this person to be the parent that always does pick up here, like to be able to think about it again in terms of what makes the most sense from the child's perspective and from their experience. And so to that end, I'm wondering, what do you recommend around the process of like involving kids in some of those conversations, getting their perspective? I 100% agree with you that children should never, for a variety of reasons, be in the position of making decisions about those things. Not healthy and appropriate for lots of reasons. But I'm wondering your thoughts on like, do you involve them in just information gathering of their ideas and perspectives, and how do they feel? Do you have conversations around that? Do you just do it as parents? What do you think works best there?
That's another great question. I think you may also see that just in their behavior on how they're relating to certain things, but sitting down and really hearing them, helping them feel really seen and heard and understanding where they're coming from is really important, and taking into account like next steps, and then talking about it with your co-parent to say, okay, This is what we've gathered.
Mhm.
I think based on this information, we should go with this strategy. What are your thoughts?
Yeah.
We've had some real sibling rivalry issues between
Mm,
my two boys,
yeah.
because my younger one just keeps thinking, even though you're 4 years older than me, I should be at the same level as you. And
That's right. They think that, don't they? Like,
okay, like you
Yep.
should be running at the same level, and you're 8 and he's
That's right.
12,
Yeah.
right? So part of that sibling rivalry stuff, we've realized like we're raising individual kids, like
Yeah. Yeah.
only children in some ways, even though they're brothers.
Yeah.
And each of them actually needs a little more one-on-one time.
Mhm.
So even being flexible with our custody arrangement, I'm like, you know what? How about if you take one on Monday night and I'll take the other, and we're just going to have some good like one-on-one time.
Yeah.
And that's been so good to
Mhm.
be able to, we don't do it every week, but we'll look for those special opportunities of just like, dad's just going to take you. You're going to have that time and then you get to stay back with me. And maybe it's not my custody night, but I still get some more time with one of my sons.
Mhm.
It's wonderful,
Yeah.
right? But
Yeah.
having that flexibility because you really have figured out what your kids are needing.
Yeah.
See, that's not about me. That's not me trying to say, oh, I just want more time with my son.
Right.
No, that's because actually based on what we're seeing,
Mhm.
he really benefits from that
Mhm.
time.
Mhm.
And children, boy, when they get that quality time and it's just them and it's them without their siblings,
Yeah.
I think that's across the boards too, Nicole. Like they
Absolutely.
can just blossom.
Yeah.
They need that.
Yeah. I think that's so true. It's great advice. Wondering in situations where co-parents are just not working together enough.
Mhm. Yeah.
What's a helpful strategy for that?
Dependent on how serious it is, I think it's important to have something like talking parents or some kind of court appointed documentation
Got it.
on this is what we're agreeing to,
Mhm.
holding to the boundaries in
Mhm.
whatever custody arrangement that you have. So if it's healthcare issues, whatever it is, that there is some kind of accountability
Mhm.
for what has already been agreed on,
Mhm.
and then following through at least on those basics.
Mhm.
So if you have agreed on the school, or if you had agreed on certain healthcare arrangements, that you're following through on it.
Yeah. Yeah.
And that if the other parent isn't following through on it, then you do need to take those steps on ensuring that at least it's going to get followed through on your time, or um, or then maybe you have to adjust custody arrangements.
Right. I think some parents are really reticent when they realize that it's not going well. Okay, we agreed on this, and even parents who have gone through like a mediation or a collaborative divorce, but then they get into the logistics of this and realize, whoa, we're not on the same page here. We're like, there's major problems. I think there's a lot of parents who are hesitant to access services through the court to get support around that. Maybe there's some stigma or bias around that. I know you do a lot of court mandated, co-parenting work. What would you say to that parent who's like, I'm listening to this and I'm realizing like, we just are not on the same, like, this is really an issue. These boundaries aren't being held to, it's constantly an issue. What would you say to them to encourage them maybe to explore some court support or professional support around that?
Yeah, I would find a therapist that's open to doing some co-parenting work as a first step. I'll often have mediators or lawyers, even if they're, receiving a call, say, oh, call Dr. Jenna, go
Yeah.
get a session first before you come
Right.
to me and then
Yeah.
want to spend, a $5,000 retainer. Like
Right.
maybe you can just resolve this in even a
Yeah.
few sessions.
Yeah.
And it's helpful, even if you do some co-parenting work just for yourself,
Yeah.
it may be how you're approaching it, what you're bringing into it, the baggage you're bringing into it. I've had a couple recently where, somebody had some previous information from their marriage and it just keeps getting projected onto the co-parenting. And you have to be able to separate some of that stuff out to then just work with the real issues that are at hand,
Mhm.
right?
Mhm. Yeah.
Because the marriage is over.
Right.
So it's so much about like, well, what about just these to-dos? Like, how can we
Mhm.
make more, ground here? Because
Mhm.
the needs are great and you got to make some decisions right now for your
Yeah.
kids.
Yeah. So getting that professional support, whether it's
Yes,
starting with a therapist who can help you individually or work with you
or
and your
together.
co-parent. But I
Mhm.
think knowing that it is an option to go to the court and get some support around that, especially if you're having some very significant issues around legal or medical decision making, like don't be afraid to access support around that.
Yes, I think, and I do actually have an online course which anybody could access. It's called Coparent Well,
Yeah.
and it's coparentwell.com, and people could take that
Right.
online. And it's like 3 hours of content. I try to break it into like 5 minute on the go little
Great.
steps. And then there's checklists and things to follow through to help yourself kind of stay on track
Awesome.
with the conversations with your ex, so that you're so you're using the time wisely. It doesn't become about
Mhm.
yourself. You just kind of follow what's
Yeah.
written.
Yeah.
Like,
That's great. And that's a great segue as we wrap up, because I was going to ask, where can people find out more about the work you're doing? I know you have a book. You just mentioned the course that you have. Where can they find out more?
thanks. Yeah. So I have the Conscious Parents Guide to Co-Parenting. You can find that on Amazon or Barnes and Noble, and Co-Parent Well. And then I have actually my own podcast, Mainspring Family
Yeah.
Wellness,
Yeah.
and you can listen to episode 6 with my ex-husband and I talking about co-parenting. And
Fantastic. I
yeah,
love it.
and then we have an upcoming episode on divorce support recovery, because we're starting a divorce support group
Wonderful.
over at Mainspring
Good.
for people that are just ready to move on. And it's facilitated by a divorce coach as well as a therapist. So
Beautiful.
it's a little different than going to, say, like
Mhm.
a church support group or a
Right.
lay
Yeah.
counselor support group, because you're
Yeah.
really being facilitated by
Yeah.
professionals in the field.
That's great. You've got so many great resources available. And what's the name of your podcast so people can go find that?
Yeah, Mainspring Family Wellness.
Awesome. Awesome. This has been such great information, really some good big picture things for people to think about, as well as some really tangible strategies. So I really appreciate you taking the time with us today, and we're grateful for the work you're doing.
Oh, thank you. And thank you so much for having me on the show. I so appreciate your voice in the parenting world and what you're offering for families, especially families with special needs. It's just so critical. So thank you, Dr. Nicole.
Thank you. And thanks to all of you, as always, for listening. We'll catch you back here next time.